Okay, let's tackle the most common chest tube complications tested on NCLEX. So please enjoy my amateur drawing of lungs and chest tube, okay? But first, we're going to review the anatomy of the lungs. Now, this is something you should have learned in school. However, this is a refresher. Now, if we're looking at this drawing of the lungs, we remember that our trachea bifurcates into two lungs. We got our right lung and our left lung. And we remember that our right lung has 3 lobes and our left lung has 2 lobes. Now, over here on the left here, we see that I have drawn some blue around the actual lung itself. This is to remind you that there is a pleural space surrounding that lung that has a little bit of fluid. And that fluid prevents friction when you inhale and exhale. Now, sometimes patients need chest tubes if they've had trauma to the chest and blood accumulates in that pleural space, or if that friction becomes irritated and begins to accumulate more than it should be. Okay, so over here on the right is my depiction of what that chest tube would look like anatomically. So this is an example of a hemothorax. We have blood accumulating in the pleural space. That gray tube is a chest tube that has ports that's draining the accumulation of fluid into our chest drain. This is a dry suction chest drain. Remember, we have 2 types. Check out my other video for the different 2 types. Okay, so let's talk about the 2 most commonly tested complications in these chambers. So if we look over to the right, we have our collection chamber. So this is the fluid draining out from the thoracic cavity and it dumps into this collection chamber. You as an RN need to measure this at a certain time frame. So if you have more than 100 cc's drained in 1 hour, you need to notify the healthcare provider. And why is that? Because then you're concerned that maybe this patient is hemorrhaging out or dumping too much. Now, next, let's look at our water seal chamber. So what we usually see in our water seal chamber is tidalling, and you can check out what that is in my previous video. So when you don't see tidalling, that constant fluctuation up and down of the water line, you're worried about a kink in the tube or a collapse of the lung, right? Because that line signifies normal respiration in that negative pressure cavity. So if it automatically stops, then you're concerned. So your interventions as an RN is to check the tubing for kinks or obstructions and also auscultate the patient's lungs. Make sure that they're still breathing. And lastly, continuous bubbling in this water seal chamber can indicate an air leak. I do have another TikTok on that, so go check it out for more.